get some break. Okay, so we were talking about the health, all the regulations and legal aspects or issues of the medical plans. Remember, very important. Here is where HIPAA, the CCMA are participants or the regulators of the patient's protected information, or all these regulations about health insurance. So that's basically what it is. It's very important that we actually understand what is the purpose of these organizations in relation to the insurance plans, rights for the clients, whether it's a private insurance or a governmental insurance, it doesn't matter. They have to meet certain requirements. And the most important one is to render a qualified and quality care service to the patients. And to render services in a lower price, because medical insurance is very, very expensive, or health insurance is very expensive. So let's continue with this HIPAA regulations about privacy, security. Remember, when we are talking about electronic transactions, electronic exchange of information, we have to keep some privacy and security. Other than that, remember, you're gonna you're gonna be in violation of the HIPAA rules. Remember, HIPAA has 3 rules: privacy, confidentiality, and security. So privacy and security are very important when we are exchanging or sharing our patients' information with other entities. Because within the facility, it's a little difficult for that to happen. But it's mostly when we exchange this information with third-party payers or our associates. Later on, we're going to learn another term. Instead of associates, we're going to call it something else. So that's basically what it is. So now, what is the purpose of these HIPAA regulations for privacy and confidentiality? Well, once again, to keep the integrity of the patient's information in the data bank, because remember, we're going to have all this information in the system that can be reached, but not non-authorized people, or it can be used for abuse, fraud. Remember, information is all the time monitored. See, if we have paper records, it's going to be very difficult for someone else to be evaluating that information without us knowing that they are doing it. So paper, somebody's going to come over and there's got to be asked permission to open these medical records. Whereas if we do it electronically, we're going to have these organizations like HIPAA and the CMS getting involved electronically. They can go there and verify, monitor, do an audit, check what's going on with these reimbursement, with these codes that are being sent for reimbursement, and see if there is any wrongdoing, if there is any fraud or abuse being committed. So claiming for services that actually weren't rendered, or increasing the level of the codes just to get paid more. As we move on with this chapter, we're going to see other terms that are used in the financial or the billing and coding arena. So we're going to discuss those because are very important for you to understand when you see these terms. So that's basically what it is. We need to know what's really going on within the medical. If we check the information, we're going to see if you are billing for the procedures that you actually did or not, because we're going to read the medical records. So that's why, that's what these organizations do. Go inside the database and review, and then compare with the claims, with the bills that you send to the insurance and the money that you receive paid, to see if you are actually collecting the money for the services that you provide, or you change things around. So that's basically how this organization works. Again, because we have now computerized or digital or electronic medical records, it's a lot easier to be monitored by someone else all the time. So that's basically what it is. Other issues and other regulations that the state have is the Children's Health Insurance Program. Now, think about this. Your child is covered by their parents' health insurance. But unfortunately, sometimes the parents let's say that they make enough money that they cannot receive assistance for the children, like Medicaid or some extra assistance, medically speaking. So the parents cannot afford, if they have 2 children, 3, and then it's going to be very difficult for them to maneuver paying insurance because it's very expensive. Or the family plan that is covered under the workers or the employer, I might say, is very expensive. They cannot afford it. And the children, remember, they don't bring no money. They spend money. They go to school. So for children under age, or for those who still going to school, still in their 20s, that they are living with their parents, there is insurance for them. Starting from the moment that the female is pregnant, that child already is receiving some health insurance. So that is what the CHIP stands for the Children's Health Insurance Program. So there are programs out there that are hosted by, Medicare, Medicaid, the government insurance, to receive this assistance. Because sometimes, once again, the family cannot afford to cover all the children with medical insurance. Children have the right to receive medical insurance due to this program. Whether you are documented, whether your parents are working, whether your parents are not working, whether they are making a lot of money, whether they are making little money, children are always covered, whether you are documented or not. So that's basically what it is. So due to this program, children are always covered. What is it that they cover? Everything that they need. Doctor's offices visits, medications, prescriptions. If it needs to be hospitalized, they're gonna do that. Preventing care, vaccinations, they're gonna get it. Even though if they don't have insurance, they will get it. But this program helps because medical personnel are getting paid for those services. If you bring your child to the medical doctor, but you don't have any insurance, probably the patient or the family of the patient never going to pay the institution for the services. But if you have these programs that are free programs, then the medical personnel who render those services is going to be compensated. That's what we're talking about. We're not talking about just that the children receive services, but we're also concerned whether the medical providers are being paid for those services. And that's where this CHIPS program comes to play. Very important. Medicare prescription drugs. Now, think about, we're talking about Medicare. So this is for people 65 and older. So remember yesterday, I gave you, and before that too, the definition about, what is the difference between Medicaid and Medicare. So this is crucial. You must understand how this works. So again, if you don't understand these terms, then you're going to have problems understanding the questions or understanding your insurance or explaining the patient the insurance. People think, oh, this is government, so Medicaid and Medicare usually are, a little confusing to understand if you have not, learned about it. So remember, Medicaid is for people who earn low income or they don't have money. So you have to meet certain requirements. And Medicare is for people who are older than 65. Of course, we're going to see some exceptions, but mostly that's the definition of Medicare. So now Medicare has a Part D. That's what is called prescription drugs. D for drugs. So Medicare Part D cover medications that otherwise the insurance could not pay. Remember, Medicare, for these people that has already retired, well, most of them, because you can retire as early as 62, because that's the early retirement. But early retirement at 62 do not qualify for Medicare. You have to be 65 and older. So if you retire after 65, you're going to qualify for Medicare. So here you're going to get your medications paid through this Part D insurance. And you should have it because at age 65, many people have lots of conditions. They are taking medications. Now, the money that you're receiving from retirement is not much. Pay your bills, to pay your rent, to bring some food to the table. On top of that, you have to pay for medical. So now you have Part A, Part B, and Part D. Part A, remember, this is the part of the insurance that covers services for hospitalization. Part B, for your primary care physician, ambulatory services. And the Part D is for drugs, for the medications. And there are some medications that usually are not covered by these, insurances. So for that reason, Medicare plays an important role facilitating these, the clients or the policyholders to receive those services at cheaper price so they can afford it. Because there are many patients, once again, that they retire with pre-existing conditions. So we are talking about people 65 and older because that's what Medicare prescription drug is all about. So this is an act, the Medicare Prescription Drug Improvement and Modernization Act. That is also known with the letters MMA or the acronym MMA. So that's basically what it is. You're not going to be asked about prescription drugs improvement and modernization act. You're not going to be asked about that, but you are going to be asked, what is Medicare? What is Medicaid? What part covers hospitalized patients for Medicare part? Which part of the Medicare covers for ambulatory services? Which part covers for medications or drugs? So for that reason, we cover it, and you need to be familiar. We have a chapter for Medicare, for Medicaid alone. So this is like giving you a little heads up of what is it that we're going to cover later on in those chapters, because it's very important that you understand. Once again, this is not just for you to pass the test, but it's for you to understand how this works. And sometimes, you can explain it to the patient, or you can understand it yourself. If you have a Medicare plan or Medicaid plan, or a member of your family, because most of you are not 65, so you will understand when that time comes. So, or your family member are talking about these plans, and if you do not receive these medications, you can understand. So that's basically what's important. So it is important for a lot of reasons. It's just important to know about it. So that's basically what we understand. Record retention. Now, we talk about this during medical record management, for how long we should keep the patient's medical records. But then we're going to add for how long we are going to keep these claims that we made to the insurance to get reimbursed, because those are legal documents as well. So this is the financial part. So we're going to see that. So record retention, once again, by law, we have to keep this documentation for a certain period of time after the patient was seen for the last time. Remember that we said that it was about 7 to 10 years. Each state has their own regulations. So we got to follow the state where we at. But for the purpose of the exams, this is a standardized, because the exam that you're going to be taking here in New York is the same one that medical assistant takes in California, in Illinois, they take in Florida, Massachusetts, any state that they take this exam, the information, the exam questions are going to be the same. So we cannot have one exam because it's not state, this is national. If this exam was state-based, then we only will talk about New York State. But it's not, this is national-based exam. So anyone who takes the exam in any of the states of the United States is got to have the same questions. So we got to cover the same standardized period of time for the statute of limitation. So that's basically what it is. So we need to keep these medical records for many reasons. Remember, after the patients start coming to our office, anything can happen. There are conditions that develops years after. So if the patient was not seen as was seeing someone else, that can go back to the previous doctor that was seeing this patient and see what evaluations were done, what tests were done, how was the medical status of the patient prior to the patient developing this condition, even though if you weren't in that place. But after 7 years, that doesn't count, because anything happened during 7 to 10 years. See, someone develops cancer, it takes 8 to 10 years for this tumor to grow and cause cancer. So that is a lot of time. Now, for the electronic medical records, we're talking about paper, but that stays still. But for the electronic medical records, well, now it is required that you can keep it as long as possible. But there's still not a law, no regulations. So if you want to get rid of those electronic medical records after 7 to 10 years, you're free to do so. That's, medical person. So that's basically what it is. So here we have, remember, you need to be familiar with this term, statute of limitation, because that's how we use it. They're not going to tell you, oh, for how long medical records are supposed to be kept in the office. No, what is the statute of limitation for the medical records? No worries, paper or electronic. We're using the same answer for either or. So that's basically what it is. And it has to be the original one. Remember, the original one, unless this patient has sued the organization and now we have to submit this due to a court order that is called a subpoena. Remember, I've been repeating this over and over and over because these are questions for exam. So if there is a court order, a mandate that we have to present the patient's original medical records, well, we have to make a copy, remember, and we keep the copy with us. Now it says right there that this original or legally reproduced form, now reproduced form because we have moved for electronic medical records. If it was paper, now it is also acceptable. Scan images or microfilms, any type of source of, electronic or digital image from these paper-based medical records, we can add it and we make it digital. It's just done, it's there, it's like a picture. And we're gonna add it and we're gonna make the file and we're gonna add this as a medical record and we're gonna keep it, we're gonna retain it. But then we're gonna create another medical record, which now it is electronic, not digital. It's not the picture that we took from your paper based like PDF formats that you cannot make corrections or anything like that. Just the papers, just the pictures. We're gonna add it to your files, but we're gonna have the other one separate, electronic one. Remember, if you started prior to the electronic medical records initiation, then you probably have a paper-based medical records. I did. I have one of these paper because, electronic medical records is not that old. Remember, that starts like around 2008, and that was not a long time ago. So prior to that, you have a paper-based medical record. We make it digital, and then we add it to the system, and we're gonna keep them, just like adding a bunch of PDF files. Just to keep it as a reference, because we have to meet this statute of limitation, remember. And remember the time frame in which we should keep these electronic medical records is 7 to 10 years. There are some states that they are, mandated, or the statute of limitation are 5 years. So, but the standardized one for the entire nation is 7 to 10 years. So that will be the answer for the question, 7 to 10 years. That will be the answer for the question that I give you. So that's basically what it is. Now, what about retention of the health insurance claims? Remember, those claims are these formats that billing department fills in with information from the patient's conditions and procedures, treatments that is being sent to the insurance to claim for reimbursement for those services provided. So these records are supposed to be kept at least 6 years. So these claims, we should keep it at least for 6 years. Now, what if the person has died? If the person has died, we can get rid of them 2 years after. Now, be careful, because this is for these insurance claims. We are not talking about the medical records. If a patient dies, and let's say that this patient is coming to our office and the patient dies within 2 years, you cannot get rid of it. You have to wait 7 to 10 years after the patient dies. That's what it is. Remember, we wait 7 to 10 years from the last time that the patient was seen. Yeah, the patient moves to another state, the patient is still alive. We don't know what the patient's whereabouts, right? It doesn't matter. whether the patient moves, whether the patient is seeing the doctor across the street, it doesn't matter. If the patient dies, it's the same thing. We keep the medical records after the last visit, whether the patient is still alive or the patient dies. That's how it works. 7 to 10. Now, for the insurance claims, it's totally different. If the patient's still alive, we're going to say those insurance claims for 6 years. If the patient dies, well, that bill was already paid. We're not worried about that. We're not talking about the medical records. We're talking about just these claims. And that's it. So that's something that you have to keep in mind all the time, just in case, because these are very common questions for exam. And I don't want you to miss this because these are the easiest one. Because it's like a close-end question. How many years, what is the statute of limitation for medical records? 7 to 10 years. What about the insurance claims? 6 years. That's it. Now you understand that. So we have been talking about this Health Insurance Portability and Accountability Act. Remember, this is HIPAA. So if they ask you what HIPAA stands for, then you have to spell it out. Health Insurance Portability and Accountability Act. But if they ask, what's the function of HIPAA? What does HIPAA do? Oh, that's a different issue. It's not health insurance portability, because you're going to have that as an option in your answers. Don't pick that one because that's not what they're asking you. HIPAA, what they do is protect the patient's information through privacy, confidentiality, and security. They have these 3 rules. So this is illegal, this is a law. And once again, this HIPAA was created in 1996. That was not long ago. Well, for some of you probably, but 1996 is not far away. It's almost 2000, and this is 2024, going on 25th. So these organizations haven't been there forever. They were brought up because all this mismanagement, remember, of services and patients' information. Before HIPAA, people was just revealing the information from the patients. Whoever asked, they were just giving it to it because there was no rules. If you're going to keep the medical records, you keep it. If you don't, oh, the patient left today, patient said it's not coming to see us anymore. Oh, let's get rid of that medical records. Now with HIPAA in place, we can't just do that. So lots of things have changed with all these new regulations. Well, these regulations, if you don't want to call it new. Because for me, they are kind of recent. So that's basically what it is. So HIPAA is very concerned not only in disclosing the patient's information or private information, but also regulating all these codes that we use in billing and coding to claim for services rendered. So remember, if you do not follow these regulations, you are under, this law's violation. So no up coding, no down coding, no bundling. We're going to talk about those things when we get there. It's got to be a necessity for that procedure, for that treatment, for that medication to be in place. Other than that, it's considered fraud or abuse. We're going to talk about the difference, what is fraud, what is considered fraud, and what's considered abuse. These 2 words kind of can be used interchangeably, but they have their differences. So that's basically what it is. Remember that waiving co-payments or co-insurance, it is violation, is fraud. We discussed yesterday about the co-pays. Remember, what is the copay? Is the amount of money that the patient pays every single time that the patient has an encounter with the medical doctor. It is a charge. This is the money that we charge you every single time. Remember, this is like 100% question on exams. Why? Because medical assistants, if you are in the front desk, you have to collect this money every single time that the patient comes in. Because that's part of the financials. These are the receivables accounts, and we need the money because by law, we have to charge them. It's like taxes, you know, when you go buy something, and if it is taxable, they charge you taxes on top of the price of the items that you buy. It is by law. It's not that someone just invented that because they want to make money in the store. No, it is by law. It is a regulation. It is a mandate. We have to pay taxes. We pay taxes from our salary. This is not an option from the employer. This is not their decision. No, it is a higher rank in the government who institutes all these regulations, and we have to abide by. So we have to follow them. So copays and co-insurance. We are going to be talking about copays, co-insurance, premium. So all those things are going to be discussed later on. Deductibles, because you need to understand what all these terms means for your exam. So co-insurance is a percentage or the total amount of your services, the cost of your services. But that is after we remove the deductible, not the copay. So those terms we will discuss it later on. Just for you to understand, because it says right there, coding irregularities, medical necessity, and waiving copays in co-insurance. So all these money that are accounts receivable, you must collect that money from the patient. Because if you don't do, then the business is losing money. But it's also considered fraud. Because if you're waiving these payments, remember, you're luring, this is like a bait that you're putting on your clients so they can come to your office because you're not charging this or that, because that money comes from the patient. The copays comes from the patient. That's the part of the insurance that the patient needs to pay. Co-insurance and copays. This is part of what we pay. And if we don't have to pay it, then think about it. You're going to come to the office that is not charging you for that, which is illegal. So that's basically what it is. And all this is a mandate by the Health Insurance Portability and Accountability Act. Because they give you all the chances for you to get insurance, to get coverage. So you can have a medical doctor that is evaluating and it is prescribing medications. So you can get your medications from your pharmacy as well. But then you are committed to do part of your responsibilities, which is pay copays and co-insurance. And your medical insurance will pay for the balance. That's basically what it is. Or your employer will pay for the balance to the insurance or your services. So that's how everything works. So we continue here with this HIPAA regulations. Another regulations of HIPAA is to improve portability and continuity of health insurance coverage. So what is exactly portability? Because remember, HIPAA stands for health insurance. So we're going to have health insurance. But what about the portability? What about the accountability? Well, portability means that you can move from one job to the next, and you can bring your insurance from one company to the next. That is portability. So you are allowed under these rules that if you decide voluntarily to quit this job and move to another one, you're going to bring your insurance with you to the next company. That's how it works. Let's say that you get fired. What happened to your insurance? If you get fired, you're going to lose your insurance. But according to the HIPAA regulations, you won. For the first 6 months, you will be covered. There is another insurance that's called COBRA that you will be eligible to join. So you don't lose your health insurance meanwhile you wait for your new job that offers you health insurance. And if those 6 months you don't get a job, well, they apply for Medicaid because now you are low income or no income. That's what is called portability. And what is accountability? Well, accountability means that you are liable as a medical provider for fraud. If you are, charging the patients for services that they were not needed, for services that were not provided, increasing the level of the services just to get more money. So that is Health Insurance Portability and Accountability Act. Every single word in this acronym means something, and that's what is there. And that's what it says right there. Combats waste, fraud, and abuse. See, waste. What is waste? Oh, wait a minute. Medical providers just ordered something that was not needed. That's a waste of money because that test should haven't been ordered on the first place because there was no need for it. But the insurance has to pay for the test, but you didn't need it. It was not necessary. So that's a waste. Or use money from the government to buy things for your office that you actually not using. So that's basically what is a waste. Waste of funds. That's what they're talking about. Fraud and abuse. Remember, we go back again. Ordering services. See, if you order a service without necessity, it's called abuse. If you file a claim asking for, reimbursement for procedures that weren't done, then that's fraud because you're intentionally doing it. So that's basically what we need to understand. And remember, abuse, you are ordering things that are not needed. Yes, the patient received this EKG. The patient did receive this blood work, this CAT scan, MRI, or this machine, this walker, this wheelchair. But then the patient didn't need it. So that's a waste. That's called abuse. You're abusing the system, buying things that are not needed. In fraud, you are benefit from it. So you're not wasting the money. You're just increasing, the level of services to get paid more. See the difference between fraud and abuse? So that's how it works. See this HIPAA organization also pays for long-term care services. If you are institutionalized, like hospitalized, whether hospitalized means hospital, or placed in a nursing home, or in a hospice, or in a rehab center, according to HIPAA regulations, your insurance have to cover for that. That's how definitely works. Unique identifiers for providers, health plans, employers. Yes, individuals. Everyone has to have an identifier. We're going to talk about those later on. So we're going to see what is the name of these identifications that we use for providers, health plans, employers, and from individuals, just like you and me, that receives health insurance. So in other words, everybody's going to be identified. And you're going to have these unique identifiers, this unique ID. The same as you have a driver license is unique for you because it has a ID number, just like your social security. Well, insurance companies, they're going to have one ID that identifies this particular insurance company. Hospitals, medical doctors are going to have a unique identifier that they said, oh, this is the office of Dr. Brown. This is the hospital, Columbia Hospital, or whatever other name it is. And you, if you have an insurance, you have an identification there because you are the policy holder. So that's basically what it is. So we will discuss this in a little more detail when we get there. That is a little further on these chapters. We're gonna have certain standards for, exchanging electronic health information, particularly when it comes to, reimbursement or these financial transactions. Well, HIPAA covers for everything, whether it is for financial transactions, but that is the topic that we are discussing in this chapter. Our HIPAA also regulates whether this information goes to another medical provider, to one of our associates, or what is the purpose of releasing or exchanging this protected health information from our patients. HIPAA has to do, remember, that's what we've been talking about all the time, create privacy standards. We're going to talk about the privacy, we talk about confidentiality, and then we're going to talk about privacy and safety for electronic data. And we know most of them because we have discussed those already. But we're going to go over because this information is very important for you to understand, because you're going to start working and you got to keep the patient's protected information secure, private, confidential. And we're going to see how that's going to work. So we're going to discuss these terms one by one. I already gave you a little overview of each one of these terms, and then we're going to go over this. Healthcare access, portability, and renewability. So again, HIPAA, this is HIPAA regulations, allows you, remember, to move with your insurance, as I mentioned before, from one organization to another. Or if you lose your insurance, you will be able to keep it until you get another insurance, or you time frame in between your, because you have limitations for how long you can keep your insurance. And if you're paying for it, you're gonna keep on paying for it. Your insurance plan is not gonna change because you lost your job. And if you don't get a job within a certain period of time, 6 months is the maximum, then, you qualify to join other insurances that are out there. We will talk about that. HIPAA prohibits insurance companies from limiting or excluding you from the plan or from medications for pre-existing medical conditions. That is something that is being talked every single time that they have a debate, whether it's political, whether it's financial. They talk about all those things that always, if you turn your TV, you're going to hear about all these retirement, social security, increase, no increase, what is taxable, what is not taxable, and so on and so forth. So Obama, during Obama presidency, he created the Obamacare. That is the insurance that we currently have that helps millions of people that do not have insurance coverage, or for those who have pre-existing medical conditions did not qualify. Let me tell you what is a pre-existing medical condition. So let's say that I have diabetes and I'm going to buy or going to join any of these insurance companies. I need health insurance. So this health insurance before Obamacare kicked in, they were denying services. If you have medical conditions, then either or we are going to increase the premium. So if the premium was $5,000 for a person who do not have medical conditions, this insurance company immediately increase the premium for people who has medical conditions already. Oh, you have diabetes. Oh, you have MS. You have heart conditions. You have HIV. You have, oh, no, wait a minute. Your insurance now is $10,000, $15,000. So back in the days, they get away with that. But after Obamacare, that including that your medical insurance should not discriminate you based on, pre-existing conditions. Or this condition that you have, you taking, you have to go to the doctor too many times. Who pays? The insurance. You taking medications that are very expensive. Who's paying? The insurance. So the insurance says, hey, I'm not going to pay for all these things. They paying me very little, and I have to pay more from my pocket. This is not business. But the government said otherwise. We don't care about you. You can make the money with those who do not have medical conditions, and then you can balance it out, but you have to render services for those who have pre-existing conditions. So that is what are these, HIPAA regulations acting up on the access on medical care. So that's basically what it is. It's very important that we understand that. Can you imagine your family member or yourself have a medical condition and this Obamacare weren't there, then you're probably not going to have medical insurance because you are not going to be able to afford it. So that's basically how it works. So now people with pre-existing conditions are going to be able to use the system and get paid for their services, regardless of what conditions they may have. So that was removed, and that's now a law for the insurance companies that you cannot discriminate. Let's put it that way. This is a lot easier to understand. Instead of saying limited, the insurance companies, exclusions for 16 medical condition. No, they were discriminating against people who has medical conditions by, increasing, doubling, like the insurance premium just because you have a medical condition. Now everybody is the same. If I pay $10,000 for my insurance, whether with pre-existing conditions or not, if you're gonna buy a plan the same as the one that I have, you have to charge you the same. You cannot go over. So that will be illegal. There is another thing, provide credit for prior health coverage. So this is not that you're gonna be credited for money that you didn't pay. No, this is not that they pay you more and now they're gonna give you the refund. No, what it's trying to tell you here is that, all your records, all the records about your financials, about the reimbursement that the medical provider claim for you, are going to be moving to the next insurance. So they're going to see what services you have received, what this insurance was paying before. So they cannot overcharge you for that, for the next insurance. Because remember, these medical insurance companies, they get away with a lot of things. They always try to sneak things here and there. So in order to prevent that, says, hey, I have a pre-existing medical condition, or I don't. I was paying this on my prior insurance, so you should charge me no more than this. So that's basically what it is. This is like when you have the medical records from the patient, or you don't. If you have a medical records, prior medical records from the patient, you can go over and see what the medical conditions, what the treatments, what the diagnosis were done to this patient. But if I don't have anything, I have to start from scratch. So it's going to be more costly. So that's basically what it is. Now, again, the portability, you're going to move to another company, another insurance. You're going to be working with some other employer, but they have a different insurance. It doesn't matter. My record from my prior insurance, even though if it's not the same, is going to move to the next one, and they're going to try to match all the costs that you were paying before. So that's basically what it is. So nothing else. Now, it's not just for you, it's also for your dependents. Remember that if the policyholder, the enrollee, if it loses the insurance or their jobs, then the family also loses the insurance if it was not covered. So that's the reason why, HIPAA regulates this. Nobody's going to stay without insurance. So all of you are going to have insurance until you get another job, or if the lapse of time is running more than 6 months, then you have to join other insurances, because there are other options for this type of situations that you can, you can acquire. So that's basically what it is. It's very important for us to understand this for our own, because if you have a medical insurance, because all of us should have a medical insurance, and maybe 90% of the population, or let's say 80% of the population works and gets an insurance. We have records for in this chapter that 60 to 65 insured people get it through their employer. Others, they have their own businesses, like small business. They have to buy their own insurance and pay their employees. But if you have less than 25 employees, so you're not obliged to give insurance to your employees. So there's lots of regulation that protects everybody. Now, just because you do not get, insurance through your employer, because it's not mandated for them to give you insurance because of the amount of employees that they have, well, there are other ways of getting medical insurance, remember. So there are other plans that you can buy, or you can buy a low cost or no cost. So all depends of your income. So that's basically what it is. But there are many options out there. So we hear about HIPAA, but most of the time we don't know that HIPAA have 5 titles. So HIPAA has 5 titles. Each one of them is like 5 stages, 5 levels. Each one of them deals with certain issues, certain regulations. So that's basically what it is. So it's not that you're not going to have it in your national exam, but sometimes it's a good thing to just make sure you know that if you see, okay, so what does HIPAA Title 1 do or includes or regulates? Immediately you're going to say, oh, there's Title 1. I did not know. There's Title 2, Title 3, 4, and 5, because it has 5 titles, remember. So Title 1 deals with healthcare access, portability, and renewability. Remember, we discussed that already. So that's Title 1. So that applies for most of the population, because everybody needs health insurance. So everybody needs health access, healthcare access. And if you lose your job or you quit, you're going to be able to move your insurance to the next company until you get another job, or there are other options after that. Remember, renewability is that you're going to renew it. You have the chance, see? Depends of, what type of insurance you have. You're going to be renewing. This is just like renewing your passport, like your driver license. The only thing that I know we don't renew is our social security number. That stays. We don't have a different card every 5, 10, or a certain amount of years. But most of the things we have to renew them. Your certificates, when you get certified for this program, it's not that it's HIPAA, it's an example that I'm giving you. The most of the things are renewable. So you have to renew your certificate every 2 years. If you don't renew it when you go to the doctor, and then they said, oh, I want to see the doctor. Sure, not a problem. So remember, we're going to check for insurance eligibility, coverage. And we enter that number in the system, and it shows there that you are not covered, that your insurance is canceled. So you have to renew it. So you're not going to be able to receive services on that particular day. Why? Because if we accept you on that day, we're not going to get paid. So that's basically what it is. Title 2 have different things. So we're going to discuss this on the next chapter because that's how it is. But we're going to talk about privacy, security, and the electronic data interchange. That will be for Title 2. How do we deal with liability? How do we deal with administrative simplification with medical record, electronic medical records? So that will be the privacy. So that's basically what it is. And the security. Title 3. Now, this is for the medical providers, the medical insurance, because they have to have, again, their own ID that identifies them for taxes purposes. Remember, we have a social security number, and through that social security number, we're going to be taxed if we have an employment or if we are making some money that is reportable. Now, Title 4 has to do with applications and reinforcements to groups, healthcare. Well, that has to do directly with these insurances companies. So that's basically what it is. And then Title 5, other things there that might not be included within the first 4 titles. So that's how it works. So we're going to talk about each one of these in the following slides. So I just gave you a little touch, a little overview about all these 5 titles, which the most important ones are 4, because it has more stuff. Whatever is not covered right here, it would be the title number 5. Okay, so let's start talking about preventing healthcare fraud and abuse. Remember, that's part of HIPAA regulations. So what is fraud? So we discussed this. I actually give you a question prior when we talk about law and ethics and in medical records. Because every word that we're going to be discussing now, we're going to talk about not fraud directly related to the medical records. Now is for financial. Now it is when we bill for services, remember. So any misrepresentation, any intentional, because it is intentional. One of the things that you have to look when you are being given these questions is fraud is something that is intentional. You did it with the purpose. How's that you increase the level of the service of this person, or you bill for services not provide? You don't do that by mistake. That's not an error. An error is that, oh, I placed these charges and it was supposed to be $50 and you place $500. Oops, that's a typo, right? Accidentally, you put a 0. Probably it's not intentional because you know that the insurance company is not going to pay you that. They're going to pay you whatever standardized fees for that particular procedure or office visit has been established by the insurance. But saying that you examine this patient and that the patient demands an CAT scan, an MRI due to these very bad headaches or injury to the head when actually it didn't happen. So that would be fraud because now you want to get paid for services that actually did not occur. They weren't real. So that's a totally different thing. So we need to understand these terms because sometimes, it might get a little confusing. So we know the medical provider knows that it's fraud because they know what they do and they know that it's false, that information that you're sending out to claim for those services is false, is fixed. So that's basically what it is. So now you're going to get paid for services. But guess what? If you get caught, now you have to return all the money, even the money that it was paid for you fairly. Why? Because I don't know for how many times you've been doing it, so we're going to punish you. So we're going to punish you with a lot of money. You're going to see later on how much money you had to pay for fraud. And the time that you're going to spend in prison, vacationing over there, without worries. Oh, wow. I don't know about that. So that's basically what it is. So once again, whether you try or not, see, some people bill for services and then the insurance reject or send back these claims to be corrected, but you continuously doing that. That is an attempt to see if it can go through. So just the attempt to do it, that's what it says right there. The attempt itself is considered fraud. You try, you didn't get it, but you keep on trying and see if you can get it because it's intentional, regardless of whether it is successful or not. So just the intent, the fraudulent intent to the insurance, particularly when it's a governmental fund, is going to have consequences. See, the difference between fraud and abuse is individual's intent. What was the intent? If you are using all this equipment or buying an equipment that you don't need, that equipment, you don't benefit. The money no goes to you. You just bought an equipment that is not going to be used much. Versus you bill for service that you did not provide. You're receiving this incentive, you're receiving money. So that is fraud. The other one is waste. You're wasting the money buying stuff that you don't need. It's like when we go shopping and we get things done. Oh my God, they are on sale, but you don't need it. And you're going to buy it. You take it home and then they're going to be sitting, laying, hanging somewhere for months, years. You ain't giving no use. That's a waste. Not because you're using the government money or the taxpayers' money, now you're going to be penalized. That's the difference right here. But it's an example so you can understand what a waste means. Spending money on something that you actually do not need. See, the word need is so important because it's not what I want. Medicals wants more money. Not that they need, they want. Because the need is for the patient. Does the patient really needs this procedure, these medications, this referral, or not? Versus, I'm going to send them for there because I know I'm going to make money. Remember, ordering things that you don't need, they have to come back to you for results and to follow up with the condition so you're getting money continuously. Versus, oh no, you don't have anything, you can go home. Fine, if you have any problems, you come back. That's it. I charged once. I don't have to be charging every single time because I asked my patient, oh, you have this, when actually they didn't have it. Because I want to have you right there because I'm going to be getting paid every single time that you come, and for every single test, I'm going to get paid. So that is what's considered fraud. So we know now the difference between those two. So let's talk about these common forms of Medicare fraud. Now, billing for services that were not performed. I've been saying this all the time because this is the type of question that you're going to get in your exam. So patients billing for procedures that were not performed. What is called? This is not negligence. This is not malpractice. This is not abuse. This is called fraud. Remember, many terms sounds like, or we think that it is. Oh, they're charging me for, I think that that's negligence. That is malpractice. No, it's not. None of those. Negligence, malpractice has to do with the patient doing something wrong to them. And billing for services is not done to the patient, it's done to the insurance. So therefore, it doesn't apply. So you have to try to understand these terms, because if you do not understand them, then you're going to be confused with the answers. See, misinterpreting diagnosis to justify payment. It's not misinterpreting, you are changing the diagnosis. So you can, get more money. Oh, let's say that the patient has a headache. Now I'm going to say that the patient has a aneurysm, which causes headaches. But this is a very serious condition. Now I'm going to spend more time evaluating my patient, ordering all those things, unnecessary tests, just for me to get more money. Yes, you put in the patient at risk, telling the patient that has something when actually they don't have it, putting the patient through all these hurdles of, evaluations, exams, therapies, when actually were unnecessary. It's putting a burden on your clients just for the purpose of getting yourself more money. Soliciting, offering, or receiving kickbacks. We talk about the kickbacks. Remember, this is a question for exam. Remember, if you have a conflict of interest I own another office, medical office, and I send my wife is a gynecologist or a dentist or a dermatologist, anything, a psychologist, a physical therapist. Oh, I'm going to send my patients over there to her, whether they have something or not. Why? Because my wife has to have business, and that money comes to her. And it's my wife, it comes to me. It's my brother, it's my sister, that's my family. So remember, that's conflict of interest. So when you hear this conflict of interest, kickbacks immediately. If you are receiving something, oh, I'm referring my patients to this person and they're going to pay me, they're going to give me. They don't have to pay you. They're going to send patients to you as well. Or I'm returning the favor. I send you patients, you send me patients. That's kickback. So that's how it works. So that's illegal, remember. Unbundling codes. Now, think about this. Unbundling. So whenever we have certain labs, we call it bundling. Let me give you an example. So my patient comes and my patient says, oh, I have abdominal pain. So then I order chemistry, 1 tube, only 1 tube of blood. And from that tube, the laboratory is going to run 100 tests. They're going to do cholesterol, they're going to go glucose, sodium, potassium, magnesium, a lot of stuff that I need to know why you're having this abdominal pain. But instead, you see, that's bundling. One package, 1 tube. Now, this is what medical doctors do. Oh, I'm going to send 1 tube for sodium, 1 tube for cholesterol, 1 tube for glucose. Oh, that's unbundling. It was a package. Now you're unpackaging. Now you're sending for individual tests. That's illegal. That is fraud. Why? Because for each test, individual test, we're going to charge more. Think about that. Haven't you gone to the supermarket and you have, let's say, fruits? You have the fruits that are standing by itself, individual fruits, like apples. But then you have a package of apples. There are 5, 6, 10 in a package. And sometimes they are cheaper. But now if you sell it individually, they're going to charge you more. So that's exactly what medical doctors do. Not everyone. I'm talking about those, those corrupt doctors. So, and it happens a lot. It happens more than we think. Now, it might not affect the patient because this is about, just getting more money. But somehow, indirectly, might affect it because the insurance is paying too much for this patient. So this patient is going to be getting some limitations. Oh, you got ordered all these tests. We're not going to do it anymore until, it's too many tests ordered. We have pay a lot for you. So they're going to request, an audit on these medical doctors. And that's how they do it. So that is unbundling. Remember, another one is up coding. Coding is to send a code for this particular service, for this particular time that I saw you, for this particular lab. Now, up coding is increasing the level of the service. I spent 15 minutes because it was a follow-up appointment. Now I wrote down that, I spent 30 minutes or 45 minutes. And I write down a lot of stuff just to justify that, I spent all that time with you. But actually it wasn't like that. I just spent 15 minutes. So that's up coding. Down coding is the opposite. You're gonna write down a lot of bunch of little things that you did, so you're gonna pay for them individually. It's not unbundling. It's just like you're gonna say, oh, the patient was complaining about this, but then the patient says that also something else it was bothering them, so I took care of this, I took care of this. So the time went higher and higher. And I spend more time and were 2, 3 different things that I have to evaluate the patient for. So you have to pay me for those 3 things and for everything else that I ordered for each complaint that the patient has. Just let's put it that way. Now, sometimes when you go to the doctor, remember this, the doctor, and remember, because you are the one who's going to be sometimes registering the patient for the particular day and visit service. So the patient says, oh, I need to see the doctor. What is the reason? Well, you're gonna be nice, right? What's the reason of your visit today? So the patient says, oh, I have back pain. Oh, sure. Do you have any trauma or anything? Oh, no, just back pain. You write it down. You don't have to ask anything else because that's the policy for you. And then he said, oh, but by the way, I also have another problem. See, I have abdominal, I cannot go to the bathroom. When I go to the bathroom, then, and not only that, I have something else. And they start telling you all the problems that they have. So then, you're going to listen to the first one, to the second one, but then you're going to tell the patient, oh, not a problem, Mr. and Mrs. Smith. You know what? All those things that you're telling me now, make sure that you talk to the doctor. Because when they go talk to the doctor, the patient says, oh, doctor, what's the reason that you're here? Well, I have this, but I also, no, okay, what is the worst thing that you have right now? So let's cover that, and then we make an appointment for the next one. Why? Because you do not want to upcode the patients, because we're not going to get paid. If you listen to the patient, all the complaints that they have, and we spend more than the time that we were supposed to for that particular visit, because it's an irregular visit, then we're not going to get paid for it. So for that reason, we have to break it down in different visits so you can come for the next visit. See, let me give you another example. Not long ago, when a patient come to our office for a complete physical exam, you're a female or you're a male? Female. Oh, complete physical exam. We're going to do pap smear. Well, back in the days, pap smear was included. Let's do it this way. First, pap smear was not included as part of the payments, the reimbursement. We're talking about reimbursement for the complete physical exam. You have to do the pap smear, but it was paid separately. Now, then change it. If you do a complete physical exam, now we're not going to pay you for the pap smear. So now I'm doing a procedure, I'm doing this, but I cannot bill for the procedure. This is what happened now. Medical doctors, regular medical doctors, don't do pap smears anymore. So then we refer you to a gynecologist. You have one? No, we're going to get you one. So now the gynecologist is going to make money. Why? Because we're going to spend a lot of time. How long do you think we spend doing a pap smear? At least 45 to 1 hour. And then we already have the visit with you. So we're going to pay only for the visit, not for the pap smear. So anytime that the patient have 2 or 3 or other complaints, if we're going to get paid, we have to split that in different visits or refer the patient to a specialist for something else. So that's how the insurance pays. Because other than that, you're going to do the procedure, you're going to do the visit. And even though if it were 2 hours, they're not going to pay you for 2 hours, they pay you just for 1 hour. They're not going to pay you for the procedure. So that's going to be included within the evaluation and management. So medical providers are going to be losing money. So it is a little, complex, but that's how it works. But in this case, is then the medical providers are saying that they did this when actually they didn't do it, and they want to charge for all those services. So that's basically what we need to, make sure that we do not follow through those. Just in case, this is for the technicians or the person responsible for filing these claims, because remember, back in the days, medical assistants were doing this. Not anymore, but still, these questions shows up on your exam and it's part of your curriculum. So you need to understand, at least to understand how the insurance, health insurance works for the patients. So that's basically what it is. Or you do procedure and another procedure and another procedure. Well, unbundling means the whole thing was a package. Now you break it down in pieces because you're going to get paid for each one of them. So that is unbundling. So keep in mind, unbundling, upcoding, downcoding. So that's basically, this is supposed to be coding, not upcoding, increasing the level of the service to get paid more. Downcoding, decreasing it, but then I have different ones. Oh no, they're not gonna notice because I'm charging very little for this one, very little for this one, less than what they're supposed to charge. No, you're still gonna fall because some of them were not done. It were not done. They're just charging, they're just reducing the level to see if you get paid or not. So that's basically how it works. See, falsifying certificated or medical necessity plans for treatment. So that's not good. Remember, falsifying is, oh, we're going to add there that you have something when you actually don't have, as I mentioned before. So in the medical, a lot of things happens. I'm not saying that every single hospital, every single medical doctor, but this is a big country and lots of insurance companies, lots of patients. So, people try to, benefit from this situation. But again, the consequences are really serious. Examples of abuse. Pay attention to this because abuse and fraud are different things. Fraud, intentionally you do something for financial gain or personal gain. Personal gain will be you falsify your certificate. You say that you are this, where you were, that you have this, when you didn't have it. So that is personal. Financial, you are getting money. So that's basically what it is. Excessive charges for services, equipment, or supplies, that's abuse. You just want to benefit your friend, your family member, or you're just buying something and you're not shopping around. Let's put it away. You just buy an equipment that probably you could buy it from another company for a cheaper price because it has the same functions, but you just got it from this person because this person is doing you favors. Or is giving you a kickback. Hey, I sell you the equipment and I'm going to send you a check. I'm going to send you a gift. So that's how it works. Submitting claims for services not medically necessary. The treatment was done, but it was not necessary. That's a waste. So that's abuse. Improper billing practices that results in payments by a government program when claim is legal responsible. Okay, so let me explain you how this works. This happens with insurances. Remember, I just went over yesterday, I gave you a little touch. If you have multiple insurances, remember, that's when this happens, improper billing practices. You bill the insurance company using the secondary insurance. That is abuse. It's not going to go through, but you intended to do it. So you have to use the correct insurance. The primary goes first. The second, that's what it says, primary policy that pays first. That got to go as the primary. You cannot switch them around. You have two insurances and you put the secondary, you put it as a primary. And the primary, you put it as a secondary. It says, oh, this is going to pay everything. So the other one is going to have all this money there because, hey, we're going to fold them. That's not how it works. Doesn't work that way. So the insurance company knows that this is abuse. You're trying to use a secondary insurance, making it pass as a primary. But the secondary insurance, when they enter into the system, they know that it's a secondary. And they know that there is a secondary, they're going to reject that claim. They're going to send it back to you. It's a correct billing ID. The insurance, we need the primary insurance. The one that you submitted is not the primary insurance. So that is basically what it is. Or billing Medicare or Medicaid with an insurance that is not covered by them. Or vice versa, using your Medicaid or Medicaid insurance to pay for other insurances. It doesn't work. It's like using your Metro card that you ride your bus, something like that, to pay for theater. Oh, I'm gonna go to watch this movie, so then I'm gonna use my. It doesn't work. But in the medical, because these are insurances, they might think, wow, that's gonna go through. They're not gonna notice. No, these reimbursement claims, they go through a clearinghouse first. This is a system that is gonna read all these claims, and if they have a little error, a misspelling, a typo, they reject it immediately. They send it back to the sender. So it's not a person that is going to be reviewing this. It is the system. That was back in the days that a system was, the people were doing that. And when people were doing that, then were they making all these mistakes and they will get away with. Not anymore. Now we have a clearinghouse, and that clearinghouse is a system. You send the claim, and it goes through the clearinghouse, through a system, it analyzes, and if you miss some information, send it back. If you have errors, send it back. If you make mistake with insurance, send it back. So it's not gonna go any further. So that's how it works. So when we get to the part, we can, talk a little bit more, but that's exactly how it works. Violation of the participating provider agreements with insurance companies. When it says violation to participating providers agreement, that means that, you are not paying for those insurances, for those services. That is from the part of the insurance company, because that can happen. They can deny services, not that you make a mistake on the claim. It's just that they want to pay for the services. They claim that those services are not covered when actually they are covered. So you have to fight with them. So those would be violations to participating providers agreements with insurance companies. Remember, it's the insurance that is committing this. Other is from part of the participating provider. You were supposed to be sending these claims with this time frame, but you didn't. Now it is too late. You send this, remember, you have up to 90 days to submit those claims for services provided. You pass that time, the insurance can actually deny paying you for those services. You're violating, you have a breach of contract. You didn't meet the requirements. I told you, you should be sending these claims within 90 days. This is 91 days. This is 100 days. It is already past due. So either or, it works, because either or is breaking the agreement. It's breaching the agreement. So that is abuse, remember, because you can expect people to break the law just because you are procrastinating sending those claims within, the deadline. If you don't do it, that's your problem. Now you got the risk. And now what is it that you're going to do? Now you try to get the money from the patient. But the patient says, oh, no, wait a minute. My insurance pays for it. So you cannot charge those to me. So that's how it works. And now the patient complains to the authorities, and then, you're going to lose the money, and you're probably going to lose the client too. So that is abuse, remember. Totally different from fraud. Remember, if you are benefited from it, then it's called fraud. But if you're just wasting the money in an unnecessary procedures, then, or equipment, oh, I want to have state-of-the-art equipment in my office. But the equipment that you have works. It is good. It's good maintenance. What are you going to spend money? Spend it in something else that is going to benefit your employers, your facility, the patients. But that's not how they do it. See, let's talk about these penalties for fraud and abuse. Either or is penalized almost the same. So let's talk about these governmental insurances, because these are the ones that, actually pursue all these investigations and, punishments, so to speak. When a medical provider commits fraud, an investigation is conducted by the Office of the Inspector General. Please make sure that you know who investigates fraud, who investigate violations by the medical providers, including hospitals, medical, nurses, anyone. It's called the OIG, Office of the Inspector General. You got to know this for your exam because they ask you this. Why? Because we as employees, we can actually, call this Office of the Inspector General if we know that something is going on. Remember, that's what is called a whistleblower. So again, there are a lot of things. We're going to discuss that a little later on, but that's how it is. Anyone can call anonymously the Office of the Inspector General to report fraud. So, question, what would you report? To who would you report fraud and abuse in the healthcare industry? The Office of the Inspector General. That's basically what it is. So keep it in mind. So someone who is found guilty of fraud, this is what they can be facing. Civil penalties, remember, civil penalties for medical professionals if they didn't do it intentionally or it was abuse. So either or. So says penalties from $50,000 to $1,000 per false claim. See, it's not for everything. Oh, you committed 100 abuse claims separate days of the year. So, we're going to be penalized for 50 or 100,000, even though that's a lot of money, right? No, it's per claim. Every single time that you do one claim, one false thing, one fraud, you're going to penalize for that. Imprisonment up to 10 years if convicted. Remember, this is intentional. So when it is intentional, you're going to end up in jail. Now, the administrative sanctions up to 10 years, civil monetary penalty per line item on false claims. Now, administrative, meaning that would be the person like you, if you're doing the billing. Because the money don't come to you, but you're the one who are, filing those claims. So you might get in trouble. Because you, as a coder, you need to read and make sure that, all the services that you're claiming are written on the medical record. It's not what the doctor tells you to do or the hospital tell you to do. Oh, just use this code. No worries. Okay, now you're paying me. Something happened, you're going to be, no. Everybody's going to be responsible. Remember, this is like medical assistance. If you commit some type of negligence or malpractice in your job, you're going to be liable. Your hospital, your medical doctor is going to be liable for you, but you're going to pay the consequences too. Remember, that is called the respondent superior. So keep it in mind. So that also applies for the billers and coders. Not only the biller and coder is the one who's going to pay the consequence, but no, who you benefiting with upcoding, downcoding, unbundling, false claims, kickbacks. Well, probably the medical doctor, the hospital as well, because they are the one who are benefiting from this. But you are the one who transcribing those codes, so you're going to be responsible. So you got to make sure that you do understand all this, because it is serious. Who wants to spend 10 years in prison? Nobody. I don't want to spend a day, not even visiting someone, much less being the one who's going to be kept over there. No way. So we got to keep our, things safe. So again, some people, just call in the office of the Inspector General when they notice something and they turn them in. But anonymously, you're protected. So no retaliation against you can happen, because if that was the way, that they're going to inform, and that's not going to be anonymously, then, you can lose your job, you can be retaliated, and then no, that is without purpose, you will be protected. Steps in identifying risk areas. Now, a lot of things going on, right? Because in the medical field, you never know what's really going on, particularly in the financials. Financials always been an issue. Financials are always being kept on surveillance, on monitoring them. So they're going to monitor billing all the time. They're going to have audits all the time, particularly when they suspect that something is happening often. They pay one, they say, oh, this sounds like, and then, when you do something and you don't get caught, then you keep on doing it, right? So then, hey, it went right the first time. Let's do it one more time, but more. Let's increase more. First, we just have one claim. Now let's use 2 claims, and then 3, and then all of them. Eventually, you will get caught because they are monitoring this. Develop written practice standards and procedures. That's how you identify these risk areas. Because you're going to develop these written practice and standard procedures, how to follow, how to fill out these claims correctly. Remember, the medical doctor is the one who writes down in the medical record, the diagnosis, the services, the procedures, the plan. So we are based on that we are going to fill out this claim. But the person who's doing the claim needs to be aware that there are certain things sometimes do not look right. Because you're going to learn, because this is specialist. This is someone who were trained in this field. This class is not for you to go get a job as a coder or a biller. No, this is just a little information for you to know. They will get the ins and outs of everything on codification and billing, so that will be a different issue. So they have to know exactly how the system works. And if there's something that it doesn't look right, something that I see on the medical record doesn't match the diagnosis with, the evaluation that the medical did, even though if the medical wrote down all these conditions, oh, wait a minute, all these conditions, but the patient didn't evaluate, didn't do this, oh, wait a minute, doesn't sound good. So you're not gonna just immediately call the office of, the inspector, not at all. You're gonna tell the doctor, oh, doctor, I need a little more information for this particular code. That's how you're supposed to address this. So again, it is our responsibility as billers and coders. So designate a compliance officer. Every single organization has a compliance officer for healthcare, for financials, for human resources. They have always compliance means, that you have to follow all these standards, that you have to follow all these policies. That's basically what it is. And if you don't, then it's going to have consequences. This compliance designated is going to decide whether, this person needs more treatment, more training. Remember, we see when have employees, they are not good at what they're doing. They're making a lot of mistakes. Well, you have to make a decision. Or you get rid of them, or you train them. Because they have a certificate, they have a license to do this job, but they don't have the experience that they need. They're making a lot of mistakes. So wait a minute, we're going to train you more, or we're going to send you to the school, or we're going to get rid of you because you are putting us on the spot at risk. Another way of, identifying risk areas is responding by investigating allegations. If something happens, you cannot keep it in the closed doors. So somebody complains about something going on, they should not just ignore it, they should fix it. Because that is going to continue, and sooner or later, they're really going to get in trouble. Remember that when you get in trouble with billing, it's not just you and the medical doctor. No, it's the entire organization where you work at that's getting involved. Because it's about your patients, it's about your clients. And if you did it to one client, you can do it to another client. So you have to have these open lines of communication, because that's how it works. Whenever something happens, so we have to get together, we have to, discuss what are the problems that are arising in our office and how to handle those. Because remember, sooner or later, this is going to blow and it's going to have consequences. And these consequences are disciplinary standards and enforce them. So you have to create disciplinary standards. Okay, if something goes wrong, if you do this, well, it's like, you're not performing okay. I'm going to give you a verbal warning first, then a written warning, and then we're going to dismiss you. So that's how it is. So it's got to be penalties, internal penalties for those who do not comply with, the task that you were assigned. Because remember, you have a certificate or license and you have to comply. You have to abide by your certificate, by your training. Follow your scope of duty. That's how it works. Shouldn't dismiss any of it. Overpayments. I mentioned it before. Just because you are getting this money from the insurance, oh, very good, nice. It went through, they didn't discover anything. Well, if they do, they're gonna review everything else, and every little detail they encounter, you have to return that money. So if you were reimbursed in excess because you unbundle, because you up code, because you down code, guess what? You're gonna have to pay. So that's basically what it is. So you didn't do anything. You're actually getting in trouble. Sometimes you can actually duplicate claims. See, you can send 2 claims for the same services to 2 different insurance companies if the patient has more than one. or send one to the primary and another one to the secondary. But remember, you switch the primary insurance. You send it to the primary, oh, you're gonna get paid. Then you send it to the secondary to another insurance that the patient has as a primary, and you think that you're gonna get reimbursed from those two, the same amount of money. No, it doesn't work that way. So if that happens, you are going to be, liable, and you have to return the money and more. You have to pay for it. Payments made to the wrong payee. See, that can happen. So they can send you money from a patient or from services, not that you claim for it, but it wasn't your patient, but you receive payment from any of these organizations, this insurance company for a patient, and that was not your patient. You didn't do anything, or you just didn't see the patient during that month, but you receive money for procedures and something. You can't just keep and say, oh, they by mistake send this, but I didn't claim for it, so that is not my fault. Well, it is your fault if you keep the money, because that money is not yours. By mistake, they send it to you. They mistakenly thought that this was your client or that you render services. You never send a claim, but they send you money. So be careful that that can happen as well. Payments made for an item or service not covered. Remember that the patient receives a notification of, benefits that they're going to receive according to their plan. Now, the medical doctor ordered tests, but this test, this exam, this procedure was not covered by the insurance. But the insurance mistakenly paid for it. And you received the money and you didn't say anything. Well, if they discovered that they pay you for that service that the insurance was not supposed to be covering, you have to return that money. So that's how it works. Once again, when it comes to money, remember, they're going to keep an eye on all these finances. And sooner or later, if they discover something, it's going to, bounce back to you. And they're going to do a complete audit, a complete review to all the claims for a period of time to see if that had occurred prior. And if it has, serious consequences. Remember, we already went over that. Overpayments includes incorrect application of deductible of coinsurance. That's another thing. Oh, they calculate the deductible was not $1,500, $1,000. That the coinsurance was not 20%. They said, oh, it was 30%. So they added. So remember, the premium is the total amount of the insurance per year that the patient is going to pay, or that the insurance is covering you for that particular amount if you don't pay for it. So within, we're going to have deductibles, coinsurance, and copayments. So what actually the insurance is going to be paying is everything minus deductible, coinsurance, and copayment. So that's why the insurance is going to end up paying between 70 to 80% of the total amount. Everything else is paid by you, the insured. That's how it works. So it's not like, oh, I have an insurance, so no, insurance pays everything. No, that's why sometimes, after you've seen the medical doctor, you receive a bill for the balance. Why? Because the insurance did not cover for everything, because you had to pay deductible, you had to pay co-insurance, and plus the copay. So that's how it is. So it's very important, again, that we understand how these payments to the insurance for health insurance are, divided. What makes up, it's not just the deductible. Think about you bought something, you bought a car. So you have to give a down payment. So that is like the deductible. Then you have to make payments every month because you're gonna start paying the premium, the total value of your car. But then you have to pay taxes over that money that you are receiving, because that money is not yours. That money might be from a bank, from a credit union, but they're gonna charge you for it. So here, it's not like you're having taxes, but we're gonna have it co-insurance. So that's how it works. So insurance is a little more complex with all these, parts that makes, the complete, insurance and payments, and what parts we are responsible, what parts are the, your employer responsible. If you are the one who's paying for your own packet, of course, you're going to be the responsible one. But if you work, so your employer is going to participate paying your insurance, but what they cover is about, 70 to 80%. Everything else, you have to pay it. They deduct it from your paycheck. Depends what plan you have. What is it that you want? Oh, you want medical and dental, and oh, well, you're gonna pay more. Oh, you have family plan. Oh, one member, two members more, three. Well, you're gonna get higher premium. Well, then it's gonna be a higher deductible, higher co-insurance. Your copayment probably is gonna be the same, but everything else changes. So again, those are overpayments. Remember, incorrect application of deductible or co-insurance. That's related to your plan. Payment during a period of non-entitlement. Now, non-entitlement, remember, that means that you were not covered by that insurance, but they paid the services anyways. Well, that money don't belong to you because the patient did not have coverage during that particular visit to your office or service. So you're going to be very happy. Let's say this is what happened, because this is the problem. The patient comes to the office. You are the medical assistant there. You do not check the patient's insurance because you were lazy, because you are not following the policies of your organization. Why should I bother? Oh, I saw this patient like a month ago, 2 months ago. Oh, no, I've seen this patient before. No. Every day, if the patient comes every day to our office, every day we check the insurance, because the insurance coverage can change overnight. We don't know what plan the patient have exactly, how much is paying for this planning, what services they have approved, what limitations they have approved, which medications, which services are not covered. So we don't know that. I don't know that by just looking at an insurance, but I do definitely know whether the patient is eligible for that day or has a coverage, because I have the card, I put it in the system, and the system is going to tell me and generate a receipt that says patient have insurance today. And it also say this insurance expires this day. That's how it is. So you didn't ask for the patient's insurance, and you did not verify insurance coverage for that day, and billing doesn't know that, because they're not going to check the patients. They're just going to do whatever, services are provided. Now we're going to send the bill, and then they pay you. But then they say, hey, wait a minute. Later on, they're going to realize and they're going to send you a notification. Hey, we pay you for services during the period that the patient did not have coverage. So you have to return that money and you have to do it. And now what we're going to do? Bill the patient. But it's not the patient's responsibility. It was you because you were supposed to be checking the insurance. Makes sense, right? So I'm telling you because I'm being in this field. I've worked in offices, not doing this. I've been a medical doctor lately. So, but I know how it functions. I learned billing and coding. I have certificates for billing and coding. I've done a lot of things. Because in this arena, as a professor, sometimes, I might get tired teaching just anatomy and physiology, microbiology, pharmacology, all those things for any courses. So I said, oh, and it's very competitive. Believe me, it's competitive. Every single job is competitive. Medical doctor is not. But get sick and tired working at that, so I have something else to do. So for that reason, you have to have certificates. So I've been getting certificates for almost everything. So if they said, oh, we need a biller and coder in this institution, okay, if you pay me this much, I do the job. Here is my certificate. So see, it works for me. So I learned all these things. This is not something that you learn just because you heard about it. This is not like that. So you're listening to me right now, you're gonna grasp certain little things here and there, but you're not gonna become a biller or coder. Definitely not. But you will have an idea because that's the purpose of this class, for you to have an idea, because you see the importance to know about, medical insurance, because whenever you start working, just the fact that you did not, check the patient's insurance for that particular day or visit, that can create a problem. Now we're not getting paid, or we're gonna get paid, but then we have to return that money. And now we have problems because we have to bill the patient. Now the patient is not gonna pay. Now we're probably gonna lose the patient too. So now we have to go through all this trouble for what? Because we didn't do the job in the first place. Because this is the responsibility of the person who is in the front checking in the patients. I'm telling you. And if you continue doing the same, your administrator, your supervisor, your medical doctor, they're gonna let you go because this is a problem. Remember, we work for money. Think about you going to work and they tell you, oh, by the way, I'm not gonna pay you for those hours that you work. So that's not fair, right? For you. But in this case, it's not fair for the practice because the practice makes that money from the patients. And that's how we get paid. That's what we have a job. So we have to understand all that. And we're going to try to avoid all these hassles of, trying. Can you imagine after you receive the money? Have you been paid somehow and then you have to return that money? I have. That's not fun at all. Somebody pay you, it's already in your account. Oh my goodness, I don't want to return this money. But it's actually not mine. They make a mistake, or somebody else pay me for something and then say, by the way, I'm not taking those courses. Because that's what happens to me. I have some independent courses that I teach. And then it says, oh, I'm going to take the course. Okay, sure. You got to deposit this money in this account. And then 2-3 days later, or before the class starts, oh, you know what? By the way, I don't want to do the course now. What is it that I have to do? Return the money. That's painful. Now, the services actually were provided in the medical office, but the patient did not have coverage. So now we lose double. So that's basically what it is. So the point here is, if we do the right thing, we're not going to go through all these issues. because these are the regulatory, issues that we are going to encounter in our office. But there are simple issues that can be corrected if we do the right thing. If everybody do the right thing, this shouldn't be happening. That's basically what it is. Payment for which another entity is the primary payer. That's, I mentioned it already. Remember, you have multiple insurance. Multiple means you have more than two or more than one. That's multiple when it has insurances, because some people don't even have one. So you use just secondary insurance and they pay for the services, but actually it wasn't supposed to be paying for it. And they realize it, they caught the error, they're gonna send you a letter and they're gonna say, hey, we pay you by mistake. You have to submit your primary insurance because the secondary insurance does not cover the money, but we already pay you. So we need that money back. And then you have to submit another claim with the actual, primary policy holder. And now you're going to use the secondary because the secondary is going to pay whatever balance the primary does not cover. So that's the purpose of the secondary health insurance. See, payments made after the beneficiary is a beneficiary, no, I don't even know how to put beneficiary date of death. See, well, it's not done, it has not happened, but it does. You are charging, remember, this is fraud. You are charging for services when a patient has already died. Can you imagine that? And that happens. Think about these people that uses the social security number from their, dead relatives. They still claim for the social security, but the family, the member that owns the social security is already dead. That's similar to that. Or you charging services, so somebody else is using the car, but the person is already dead, but someone else is receiving services on behalf of that person or under that person's name. So that happens. So it is very serious that, you get involved with this. Sometimes, it happens this because I have encountered those situations. Family members, friends, they kind of lend their, insurance card to someone else for services. If we encounter that insurance does not belong to you and you use it, well, that's fraud that you are committing it. And for the part of the medical providers, well, we're going to have to return the money, even though if it was the patient who was using somebody else's card. But we have to return the money. So a lot of things happening. People always looking for the loopholes, and see how they can get away with, getting paid more, doing these fraudulent things. That's basically what it is. Any questions? Okay, so let's do this. I finished this slide. Let's go on break. It's already 7:10. Wow, time runs very fast. So let's do this. Let's go take a break. We're gonna come back 7:40 because I have to do a little something, and 30 minutes is not gonna be enough for me this time. So let's return back 7. Oh, well, it's gonna be 30 minutes anyways because it's 7:10. 7:40, and let's do 7:45, and then we meet back again 7:45, okay? And continue with this chapter. Got it? Okay, see you then. 7:45, remember, it's gonna be post, so don't
Would you
panic.
pick up?
All right.
Thank
See you
you.
later. Okay, Joan. Take care.
Thank you. See you later.
Okay. Okay, so we are back. I hope you guys enjoy your break. So let's continue with this chapter. Can you guys hear me?
Yes.
Oh, perfect. Okay, so let's go back to that part of, okay. Medically unlikely edits, provider liability repayment. Oh, I think that we covered this. Let's see. Okay, so we were talking about overpayments. So we're gonna continue with this overpayments. Remember that if for any reason the medical provider receives money from their patients and it wasn't done correctly, well, we have to return that money. That's basically what is an overpayment all about. Waiver of recovery of overpayment. Waivers, remember, the waiver is when, it's an exception. Overpayments discovered subsequent to the third calendar year after the payment year. Okay, so let's say that, we have certain ways or arrangements for payments. Sometimes the payments are done the first day of the month, at the middle of the month, at the end of the month. So whatever the times that we get paid is when we get reimbursed. So that's basically what it is. If those overpayments goes beyond certain period of time, now again, what I'm trying to tell you is like you can recover them. Think about, you paid for something and you don't go back to the place where they overcharge you within certain period of time. You cannot claim the money. That is basically what it is. So you're gonna have some grace time in between the time of the service and the time that you can claim the service. That's basically what it is. So remember that if you don't file a claim within 90 days, the insurance actually can deny you payment or reimbursement. The same happens if you've been overpaid, but you don't claim this money within certain period of time, now you're gonna lose it. So that is basically what it's telling you. So overpaid physician is found to be without fault or is deemed without fault. Now, this is a little different. You were sent a bill for overpayment, but actually it wasn't an overpayment. So there is a waiver. So waiver means, once again, that you don't have to return the money because it wasn't your fault. So some issues within, the process of the billing or something else, or, the insurance company made mistakes with the insurances of the patient, but the money actually is worth it. So you don't have to return the money. You don't have to overpay. Both provider and beneficiary are without fault on an assigned claim for medically necessary services. I mentioned this before. So let's say that the insurance claims that, that procedure was not necessary, or those medications or those services, and they don't want to reimburse the medical provider for that. But it is. So now after they pay you, they say, oh, no, we want you to return the money because the service that you provide was not necessary. So now you can prove it. You can send more information from the patient's medical record. So you can demonstrate that actually that procedure was necessary, or that service for the patient, so you don't have to pay. So that's another thing. So there are several situations in which, remember, you have to return the money, and others when you don't have to, because remember, the insurance companies sometimes don't want to pay, and they're going to use any means to make sure that that they can get their money back. But when you can prove it, because it was not at fault from you or from your patient, then the insurance has no other option but to pay you. If the beneficiary is liable for an incorrect payment, now, if the beneficiary, in this case, it might be the policyholder, or because the insurance is paying through the policyholder, or the provider that is going to get the money. The CMS or the SSA may waive recovery. The benefits was without fault, so they will help you to get that money. Again, if it's not your fault, in other words, you can get your money, so you don't have to return the money. See, sometimes, I don't know if it happened to you, it is very common in your taxes. In your taxes, sometimes they can overpay you or underpay you. So when you receive your taxes and you receive some money sometimes, or you have to pay them, it might be because you're earning more than you're supposed to, so you pay more. So the deductions are higher, whatever you receive is less. But if you are not making enough money, the deductions are less and you receive some extra money. But not everybody who files taxes receives money. So sometimes you have to pay them. Why? Because they didn't deduct as much as they were supposed to. Or the person who helped you to file the taxes didn't do the right thing. They tried to get more benefits for you, but at the end, what happens is that it's going to go against you, because the insurance, the IRS is going to claim for that money that was overpaid. But the other way also happens. If they underpay you, then they will say you check, or they deposit money on your direct deposit if you have one, for the money that they didn't pay you. So it's either or. So remember, this is a waiver for each one of the sides. For the beneficiary, because the beneficiary can be the insurance or it can be the provider. Remember, the insurance, if they get the money, they are the beneficiary. But if the medical provider gets the money or have to pay, they're going to pay the money, and they were the beneficiary because they were the one who received the money. So that's basically what it is. So if it was an error or something that is incorrect, they're going to get the money back. But if it wasn't an error, then you can keep the money. So that's basically what it's telling you right there. So remember, the laws are made of, to protect the consumers, but also the providers, because they are the ones who are rendering the services. So it favors them. Providers' liability for overpayments. Remember, liability, remember, you are responsible. So providers are responsible for reimbursement of overpayments when the following happens: incorrect reasonable charge determination. Incorrect. Just because the insurance make a mistake does not imply that we can keep the money. Remember, it was not. They send more money for the services. It's not that they are being nice to you or else. No, it's just that they make a mistake. So remember, sometimes we have a clearinghouse, which is an electronic operating machine that reviews those bills first, those claims, and then they distribute those claims to the different insurance companies. And someone over there is going to open them up in the system, in the computer. They're going to go over, they're going to check that everything is okay, and then they're going to reimburse the medical doctor or the hospital. But sometimes, because the clearinghouse went through it and didn't caught mistakes, then the person who reviewed them says, oh, there's no mistakes right here, and just kind of scan over and nothing much serious, so they just put the bill through. And then they pay. But then, if it was an error, you had to return the money. If it's not, you can keep the money. So remember, incorrect reasonable charge determination. So you have to return the money. Provider received duplicate payments. That's also true. Sometimes they pay us for the same bill twice. Remember, machines, computers are not, they are programmed and they can make mistakes, and they can generate two payments for the same patient at the same time. So we can get double pay. That's what we're talking about, for the same patient. If that's the case, remember, it's not our fault. It's not that we did something wrong. It's the system. When they processing these claims, it was sent as double. So we have to return the money. Receiving a payment after accepting an assignment, beneficiary receives payment and remits to provider. Okay, so this is another thing. So the provider files the claim, send it to the insurance company, gets paid. But then it took a little long to pay. Probably start giving you a hard time. It's not gonna pay, it's not gonna pay. You do different attempts to get the money, appealing to that, rejected claim. Then you send the bill to the patient. The patient pays, but then the insurance pays you too. Now, if that's a responsibility from the patient, you have to return the money to the patient. If that's responsibility from the insurance company, then you have to return the money to the insurance company. So that's basically what it is. Remember, these situations happens, and that's what they are written here, because we have a precedent about situation like this happening in the past. So during these financial transactions and processing, they have to take in consideration every single detail. Because remember, this is the money for each of the organizations. If it is the insurance, you don't want to pay more than you are supposed to. And if it is the part of the provider, you don't want to lose the money for the services that you deserve. So either or, both of them has rights, remember, but you have to be fair. Provider receives two payments. Okay, so once again, it might be from different insurance companies, or it's just that there were a double billing. So you have to return the money for that. Provider was paid and did not accept assignment. Now, remember that accepting assignments means that the medical doctor sign up with the insurance company and accepts what the insurance company offers for each service provided to your patients. So that is one of the things that you have to be in consideration. I sign a contract with you. You offer me to pay me this much for this particular visit, for this particular procedure, and agree with. Now, in this case, if you do not agree, then you don't have a contract with them. So you have to return that. Sometimes we initiate contract with someone. Then it was not processed because we still have not reached an agreement, a consensus. We're still in negotiation because I want the insurance to pay me a little more. But then the billing company thought that, they already have an agreement and it sent these bills according to the insurance of the patient, send it to them. But we still have not a kind of, concluded, close contract deal with these people. So then you have to return the money. Remember, we're still not partners. I'm still do not have the contract with these people. It is in the process. We have not reached an agreement or consensus with them. Remember that we can negotiate payment for services. And that can happen. Provider furnishes erroneous information. Now, that's for the part of the medical provider or the billing department. But most of the time is the provider. Remember, the provider is not your insurance company and not your billing department. It's you. Medical doctor, you add procedures or services that actually do not match the diagnosis or the procedure that you're going to order. So for that reason, you have to return the money because you get paid under the, the suspicions of that these charges were fraudulent, kind of, because they do not match. Remember, everything that the medical doctor do to evaluate the patient to come out with a diagnosis and then with the treatment, everything has to match. If they don't, then these services that you're claiming are not valid. So that's basically what it is. Now, erroneous because it was a mistake, kind of. It might be intentional, but it's a little difficult. But again, it's from the side of the medical provider. Didn't give the billing department the correct information about what was done to the patient. So there are some kind of, blurred lines within this bill, and now we want you to clarify, submit more, documentation, or pay us back because we overpaid. So it's a lot of things going on with, you see how many things we have discussed about, abuse and how fraud can be committed in the medical, because there are so many things, so many ways of, getting away from, from these payments that, from these legal issues that people will do almost anything to get money. So unfortunately, that's what is happening. And this happens mostly with private organizations or from people who works with the government, taking insurances from government. So that's basically what it is. Because, when I'm saying private, I'm not saying private insurances. I'm saying private offices. Because if they are benefit themselves directly, an organization, a hospital is a little more difficult to do this because there is no one person doing something on purpose, because the doctors who provides services to the patients, they are not going to be compensated. They're not going to get this extra money. They're going to be, we are salary people. So we are working for the hospital. So what is the purpose of me increasing, upcoding, and bundling all these codes? It will make no sense. First of all, we have nothing to do with the billing. Nothing. Some of the medical providers have no clue about billing and coding at all, because that's not what we do. I know this because I learned this separately, not because it was part of my training, not at all. Now, medical providers who own their own office, they have to learn this because you're going to be, making sure that you are the one who's going to be controlling your business and your financials. So these are the type of providers that will be doing or committing this type of fraud. Let's say small practices. Clinics, because they have one or two owners, maybe three, so they split the money that they make. But a hospital is a little difficult to do that. For the hospital will be more like an error, something that they did, but it was not on purpose. The hospitals commits more abuse because they buy stuff that they actually don't need, or they say that they bought it for this reason, but actually they invested in something else. That is a different issue. Or you buy supplies, too much of the supplies that you don't need, and those supplies have an expiration date. Now you have to throw them away. Because remember, in the medical, most of the things have an expiration date. These gauze pads, they have an expiration date. Needles have an expiration date. The tubes where we collect the blood have an expiration date. All these kits that we do certain testing, like pregnancy tests, like glucose levels and things like that, they have an expiration date. So if you have too much of these supplies and you're not using it much, you have to get rid of those because you cannot use it. So that will be waste. Or buying a machine that you're not using it much, just because you have, you want to have state-of-the-art equipment, but you're actually not using it. What is the purpose? So that will be kind of waste, kind of, abuse, instead of being fraud. But fraud happens most of the time. So another one submitted a claim for services that were not medically necessary. We talk about that. If you do it, remember, it's abuse, it's not. But then you had to return the money. This is the problem right here, overpayment. You will not be accused of fraud, but then it will be abuse. But abuse usually is not punishable. Fraud, it is. Putting claim for something that is not qualified for Medicare reimbursement. That also happens. But now, this is the fault of the medical provider and the biller or coder, because you should know you have a list of things that this particular insurance pays, covers, or doesn't. So you have to make sure that, you are in continuous communication with the medical provider about these diagnosis, services, codes. Remember, the medical provider doesn't write a code. They write down whatever procedure, whatever medication, whatever surgical procedure, whatever equipment the patient needs or doesn't need, and then we're going to claim those for reimbursement. Then, that's where the problem arises. So the Medicare did not reimburse for those. So now, because they pay us and we weren't qualified to receive the money for those services or equipment, we have to return the money. So they are very serious about this. Remember, Medicare is the government. Medicaid is the government. Military is the government insurance, so you can play with them. Items of services furnished by the provider who is not qualified for Medicare reimbursement. Here we go again. So this is like, we send in these charges, these claims to Medicare, when Medicare is not the one who is, reimbursing for these items. We know already. So if it's not qualified by Medicare for reimbursement, then it's the same. That's what it says, items of services furnished by provider who is not qualified for Medicare reimbursement. Now, in this case, it plays a little bit about provider. The provider does not have a permission to come in or to ask for reimbursement because it's not a participant. That's exactly what it is. So the patient has Medicare, but this doctor does not is not a participant of Medicare. I don't have contract with Medicare. How can I receive services or claim services or, send this claim requesting payments? You're not going to pay me. Remember, we talked about this yesterday. You have this particular internet services. And then, some other company is going to charge you for the service. I said, wait a minute. No, my company is this one. I don't have a contract with you. So I'm sorry, I'm not going to pay you the bill. Or vice versa. So that's basically what it is. So this medical provider, in this case, they do not have a contract with Medicare, but the patient has Medicare. Remember, always check the patient's medical insurance and make sure that our organization, the one for which we're working, they take this medical insurance. Because if they don't, we're not going to get paid. Even though if we reimburse the company, they're not going to send us the money. They don't know who we are. We do not have a contract with them. So therefore, their clients, their policy holders are not going to be, they're not going to be reimbursed through us because it's not going to happen. So it can be either or. Remember, you are a participant on Medicare, but then, you send for services that Medicare do not pay, but they pay you anyways. They want the money back, you have to pay it. In this case, you are the provider, you are not participant with Medicare. You do not have a contract with them. But then the patient who has Medicare come to your office and you accept their insurance. You shouldn't, because we don't take Medicare. So what you taking it? But you take it, and anyways, it says, oh, I make a mistake. But we provide services to this patient. I'm gonna send it. Probably, it's gonna go through. Yeah, probably it's gonna go through. But if it goes through and they discover that you are not participant, because they will, then they're gonna say, hey, we don't have contract with you, but we already pay you for this patient. So return the money, and you have to return the money. So that's how it works. So you got to make sure, once again, your job learning this is every time your patient comes in, you got to check insurance. Make sure that you are eligible for that particular day, or you have coverage, and that the office where you're working, they take that insurance, particularly if you work in a private office. Remember, medical doctors, private offices are the ones who run through most of these problems, because the medical assistant, or whoever is in the front, responsible for registering these patients, you do not do your due diligence. You do not check for the insurance. You just believe whatever the patient tells you. Do you have insurance? Yes. What insurance do you have? Oh, I have Oxford. Oh, I have Fidelis. Okay, no problem. Oh, good. And what is the problem? What are you here for? Oh, for this. Oh, no problem. Just have to sit in the waiting area. The doctor is going to be seeing you soon. That's how we respond. That is wrong. The whole thing that you did is totally wrong, because you have to verify that the patient, and you have to see the card. You have to ask the patient, can I have the card, please? Can I have your insurance card, Mr. Mrs. Smith? Sure. And then go and verify in the system. You enter the computer, right there is Medicaid, Medicare, right there is Oxford, United Healthcare, Blue Cross, Blue Shield, whatever insurances you have, we have it in the system. You open that application, enter the patient's ID, and click submit. And then a screen pops up and it tells you exactly patient availability, is eligible from this day to this day. So you know now that the patient has coverage for the particular day. And they tell you actually what is the copayment, if there is any copayment. Remember that the copayments are written right there on the card. So you gotta make sure that you do that. And not only that, when you have a new patient, you have to make copies. This is question for exam. For the first time you have a patient or the patient has changed their insurance services, then you have to make copies front and back and keep it in the medical record. Or make copies of those, or if it is online, you have to make the change immediately. If you have electronic medical records, you have to change the status of this ID. Because if you have the old one, that's the one that is going to be submitted for the claim, but the patient has a different insurance. Now we're not going to get paid. So again, that is the purpose of this class, that you understand that if you work for a doctor's office, remember, I'm always talking about doctor's offices because most of you gonna end up working in a doctor's office. Most of the medical assistants, new grads, ends up 60% of the time working for a doctor's office for a small practice. And then when you gain your experience, probably then, if you apply for a hospital, because hospitals, most of the time, they ask for experience. They want someone that has at least 1 year experience. I'm not saying that you're not gonna get it on a hospital the first try, but there are more probabilities that you get into a doctor's office. And what is the difference? The difference, what is it that you're gonna do? In a doctor's office, you have to be in the front and the back. Whereas hospitals, you're gonna be doing the clinical. You have nothing to do with the administrative part, nothing. The only thing that you have to do with the administrative is to make sure that you follow HIPAA, that you follow OSHA regulations, because you're gonna be having access to the patient's protected information. You are going to be interacting with the patient. So privacy, confidentiality, and security. And if you do some procedures, OSHA, meaning keeping yourself safe and your patient safe, following all the policies, all the requirements for that particular procedure. So for that reason, this is important. And not to mention, the final exam, because you're going to have questions from here. And if you kind of, familiar with this, now you can understand how this works. So you can understand the questions, because you're going to say, anytime that you see certain things, says, oh, I know these things. I know how it works. Or at least you have an idea. Because it's different when you have an idea and when you don't. So that's basically what it is. We continue with this provider liability for overpayments. Overpayment was made because of a mathematical or clerical error. Now, that can be done from either side. It can be an error because you are claiming this much, or the insurance did the wrong calculations. Remember, with medical and billing department, you got to take in consideration every single thing. Because remember, when we receive that money, we don't want to return it. So, but there are certain, issues, certain legalities right here that you have to follow, certain rules, certain policies. And if they are committed for either side, whether the insurance make the mistake, whether the biller or coder made the mistake, well, whoever made the mistake for the price. Provider does not submit documentation to sustain services. Now, again, I mentioned this before. You do a procedure, but then you don't send enough information to the insurance company to back up this procedure, to prove that this procedure was needed. Then, if you don't prove that information, they're going to claim the money back because they might assume that this procedure was not a necessity. So that is something that can happen too. And it's written here because it happens. Overpayment for rental of durable medical equipment, that is called DME. Durable medical equipment are things, that the patient might need it. Like, for instance, wheelchairs. What is called these machines that you use at home when you go there, the oxygen tank, if you have problems with breathing, humidifiers, other equipment that you might need. So when they give you a blood pressure machine, when they give you the glucose test, devices. So if they assign you something, if they overpay for these devices or equipment, then you have to. Or for the ambulance services. Oh, they pay you too much for the ambulance services, so then you have to return that money. So whoever, we're talking about billing in general. So anything that you've been given because you're not be able to walk at home, because you have these type of disabilities and you need certain equipment at home because you can't come to the hospital to be reevaluated, and you need this in order for you to go about your daily activities, and we have to provide that. But if they are, because remember, sometimes they give it to you. If there is a small device, they just buy it and give it to you. But sometimes this is a large equipment, so you might have to, they rent it from somewhere. It's not that you're going to get it, you're going to need it for temporary use. So then, you have to turn it back. But if they overpay for this, then they're going to get the money back. That's how it works. Any questions about, overpayments? Now, once again, it's not that you're going to have these questions on your exam, because usually for overpayment, they're not. But they're going to ask you about abuse, or they're going to ask you about fraud. So you have an idea when it's fraud, what is abuse. For overpayments, no, because you are not taking a billing and coding class exam. So you will not. But you have an idea now, the difference in between, for which reasons, we have to return the money. We don't get in trouble. It's just returning the money because the services that we provide do not qualify for that, for all the reasons that we covered already. Now, medically unlikely edits. Now, very similar to what we covered before, but this had to do with codes. How we utilize those codes to, get the reimbursed for services. So these medical unlikely edits are established by the Medicare for CPT or the HIPS level codes. Now, CPT, what CPT stands for? Remember, CPT is the current procedural terminology. And what it's used for. So this pays services. Any procedure, procedures. Any procedures that we do, like blood, x-rays, CAT scans, MRIs, all those are procedures. We have to use codes, CPT codes. Now, the HIPS level 2, now this is a system used for Medicare to identify and deny claims where a provider has billed for an unusually high number of units. Now, let me explain you this. Sometimes the medical doctor encounters a situation. Now, this is not that you have to return the money. No, you're going to get paid, but you got to prove why do I have to pay you all that. You're doing a procedure, but the procedure got complicated. Now I have to fix something else. Something else is more serious. We weren't planning that. So now you have to add, remember, for these procedures now, you do codes for those procedures changes. So for services, we were adding some codes, extra codes to claim for that money. But here, those services for a single procedure on the same day of service. Remember, I'm supposed to be doing this procedure, but something else came up. Remember that I gave you an example. The patient came here, is complaining about chest pain. We're just doing an EKG, but suddenly the patient collapses. The patient have a heart attack. Now we have to do more. But that's not what the reason that the patient came on the first place. So I cannot bill only for the visit, chest pain or shortness of breath. Now I have to add that the patient collapsed, that the patient have a heart attack. I cannot bill either or heart attack. And what about my first visit? So for that reason, we are going to do some edits. Edits means that it is acceptable that I add a second code or a third code, because we're going to get paid for those services, because something really happens. It's not that I'm upcoding. It's not that I'm using a different code. No, these are two different codes that I'm using, because there are two different situations in the same day, in the same visit. It's not in separate days. It has to be in the same visit. Something else happened. A patient came here because he has abdominal pain. But it turns out that the patient has appendicitis. Well, I'm going to bill my patients for appendicitis just for the diagnosis, for that evaluation, but also I have to bill for services for doing a sonogram or a CAT scan to check and to evaluate the appendix. That's basically what it is. So this is a service that was required. It's not something that it wasn't needed. It's not something, well, if someone comes here for abdominal pain, what do I need to do a CAT scan? There's no need. What are you sending for these, or X-ray? What are you sending? This is not, doesn't merit this type of procedure. But they're not going to bill for both. Two procedures. I did the evaluation and management, and then I'm going to bill for this exam. So I have the documentation. I have the necessity to bill for those two codes. So that's basically what it is. In these cases, yes, you cannot a different code, so you're going to be getting paid for both in the same visit with the patient. Other than that, you're not allowed to do so. So that's basically what it is. So these HIPAA level 2 codes, these are more likely for durable medical equipment. That's how we use it. Now, CPT codes level 1, on the other hand, is the same. CPT and the HIPAA level 1 is the same. So again, this is a little complex with these codes, because we use codes for regular procedures, and when something goes beyond that, certain equipment that you have to give to the patient so they can use it at home, that we use different codes. So that's basically what it is. So we can figure it out exactly what it is. We don't use just one code. Remember, we use the evaluation and management, E&M, that's what it says, evaluation and management, just to check you out, just to evaluate you and come out with the diagnosis, and then with the treatment. But for those procedures that we do, for the condition that the patient came in, like drawing blood, like doing EKGs, like doing vital signs. Those are CPT codes. Those are part of the procedure. But if we encounter that the patient has a problem, a disability, serious condition, that the patient has to manage this at home, and we need to provide them with certain equipment, then we're going to use a different code. We're not going to be using the same. For diagnosis, to diagnose the patient, we have different codes. So for the evaluation, one code. For regular procedures, one code. Different codes, I mean. For equipment that we give to the patient, a different code. For everything, we have codes. It's not that we have one code for everything. No, every single time that you get something, you have a different code. Think about when you go to the supermarket. You don't see the prices. There is a barcode in each of the items that you want to buy. Or they have a price, it doesn't matter, but it has a barcode. You have to pay separate for each one of them. It's not that you're going to get a bunch of stuff and then it says, okay, I'm just going to pay for all these things one price. No, for each item, you have to pay. Every single time that you come to the doctor's office, to the hospital, to be evaluated, we charge you for every single detail. The more procedures that we do, the more codes that we're going to use. Blood has one code. Urine has another code. Fecal material has another code. Seminal fluid has another code. Vaginal fluid has another code. Biopsies have another code. And each one gets paid differently. If I do an EKG, that's another code. So everything changed. Pap smear is a different code. Colonoscopy, different code. Mammography, different code. And each one has their own amount of money that we get reimbursed for it. So that's basically how it works. Other than that, can you imagine? That would be nice, right? For the patient, not for the clinic. Just pay just one amount of money and that's it. But that's not how it works. Just to come to see the doctor, you pay. If they order any procedures, anything that is being done over there, not just talking and me evaluating you, if I do a procedure, anything at all, we charge. That's why the health insurance is so expensive. Because there are a lot of things that we need to do. I already explained you about unbundling CPT codes. Remember, a code is supposed to be a group of things. This is a package of condition or procedures, but then you separate them. That is called unbundling. Remember, bundling is to put it together. Unbundling is to break them apart in separate items. Remember that I gave you the example. You're going to buy oranges. Oh, you see these nice oranges right there. Individual oranges, they have one price. Then you have a bundle. They're in a box or in something. Maybe they are cheaper because they are cheaper when you buy in quantities. It's cheaper when you buy individual. That's what it is. So here is the purpose is to charge less to the patient, to the insurance, for a group of things that they are together. They should not supposed to be separating them. So that's basically what it is. Some bundling because that is not legal. Remember, that is being monitored and evaluated by the National Correct Code Initiative, where, they're going to determine if appropriate codes have been used for reimbursement. So know about unbundling, coding, up coding, down coding, because that's basically what you need to know from here. Administrative simplification. This has to do, again, with all the electronic data interchange. Because now we are in the in the era of all the medical information being online, being computerized, and we can interchange or share this information with other providers. Well, we have this information, at the risks. So now we have to talk about security, privacy, confidentiality. So that's basically what it is. So whenever we talk about administrative simplification, it has to do with the electronic health records, how we exchange this information with other organizations, and the risks that this information takes from, being exchanged or having other people access to this information, because the violation of, security or confidentiality with this information. Now, what happens if you violate the HIPAA, privacy, confidentiality, and security? Remember, violators can be penalized within more than between $50,000 and $1.5 million. So you get violation. Per each violation, you can get penalized $50,000. So the more violations, the more money that they're gonna penalize the institution. And they can go up to 1.5 million per year. That's a lot of money. Just because you do not talking about you in general, just because, people do not, keep the patient's protected information confidential, private, secure. So that is the Administrative Simplification Act that deals with it. So here it says, what are the violations? Wrongful disclosure of individual identifiable health information. When we talk about identifiable, means something that can identify the patient. So what identifies the patient? Patient's name, patient's date of birth, patient's social security number, patient's address, driver license number, patient's medical insurance ID, patient's email, patient's cellular number. So any information from the patient that we can identify that this information belongs to the patient is called identifiable. So that's what we call it, protected health information. Each offense is going to be charged with $50,000 and imprisonment for more than 1 year, up to 10. Offense under false pretenses, $100,000 plus imprisonment for more than 5 years. False pretenses means that, you are not a registered, certified, licensed medical provider and you are billing as such. Or the patient actually didn't have any medical conditions and you are billing assuming that the patient has those things. Now, if you're gonna sell the patient's information, think about it. This happens particularly famous and infamous people. People always want to know and put some dirt or throw some dirt on people. So knowing the medical conditions, they can put some dirt on people, particularly people that are famous or infamous. So they can be charged with, more than 10 years imprisonment and $250,000 per violation. So that is a lot of money for not keeping the patient's information private, confidential, and secure. This have happened, so think about it. Let's talk about these unique identifiers. This is important because every single organization, the patient has an identifier. We talk about that. The medical provider has an identifier so they can bill, they can get reimbursed. Hospital has an identifier because all of this is for tax purposes. That's basically what it is. So we're not going to discuss how many numbers, whether it's alphanumeric or not. No, it's just that, that is how it goes. Think about you. Think about me, all of us. We have identifiers. As a patient, you have an ID that identifies you as the patient from this particular organization or institution or medical facility. It doesn't matter. Well, the providers also, because the providers is not the license, it's not the medical license that we're talking about. No, it's not. This is a provider's identification number. This is the employer's identification number. This is the insurance identification number. Each one has an identification that when you file taxes, they're going to see who is underneath these IDs. That's basically what it is. So here we have the national provider identifier. National provider is assigned to a healthcare provider. I have a national provider identification. So let's say if I have my own practice. Why? Because I'm going to get reimbursed. That's the only way that I can get reimbursed. If I work for a hospital, I don't have it. Who has it? The hospital, because the hospital is getting reimbursed. So here we have the national standard, employer identification number, EIN, see, MPI. So pay attention to this because sometimes it comes in your exam, particularly the national provider identification and the employer identification number, EIN. You know why? Because this has to be on the form, on the claim form. On the claim form, we have to write down who was the provider who rendered the services, because it's the one for which we are going to, receive reimbursement. Now, the employer identification, this is the person for whom we are paying the services. So this will be the policyholder, an employee that works for this particular company, and that's how they're going to be identified. This is the employee who's giving insurance to their employees. So the employer pays the insurance. So they are identifying them as such. Remember, all this is for the purpose of paying taxes or the IRS. So everyone is going to have one. Here we have electronic healthcare transactions, because nowadays things are not done manually. Back in the days when I started working, this billing was done manually, and it was sent by mail, just like we write down the medical records. We kept all the medical records in paper. Well, billing was not an exception. So all this was done in paper and it was mailed to the insurance company. So think about the time that it took for us to receive reimbursement. A lot of time. So now everything is done electronically. So that's what is called EDI, electronic data interchange, because now we are going to share the information with other providers, with other organizations. So that's basically what it is. And remember, here HIPAA acts because privacy, confidentiality, and security of this information that is transmitted via internet electronically. So here we know already this, what is privacy, what is confidentiality, and security. So privacy is the right of individuals to keep their information from being disclosed to others. So this is the right that the patient have. And we have to be abide by that, protecting the patient's information by all means. Now, remember, privacy is keeping everything there that nobody sees. Confidentiality is disclosing this information to other people without the patient's prior authorization. That is the difference. So privacy and confidentiality is not the same. If I'm keeping my computer screen away from the patients to see somebody else's information, that is privacy. If I'm keeping these paper medical records away from other people seeing, so I'm not going to leave it unattended, that is privacy. If I close the doors, the curtains when I'm examining my patient, that is called privacy. Confidentiality is somebody calls over the phone, hey, it's my wife, my this, my that. There, can I have the information? What was the reason that you went there? You cannot disclose that information. That's confidentiality. You cannot give the patient's information to no one by any means. That will be disclosing the patient information. That's a totally different issue. Security. Now, security means the information that is in the system has to be secure. That's what we have. Login in and passcodes. We mentioned this. Every single person that uses the electronic health records get assigned a passcode and a login information. And it's going to be used only for you. Because we're going to make sure who entered and what information was seen for this person that has these particular credentials or login. So that's the most important thing, and we have to understand that. And everyone who starts working has to be trained, has to be explained. Even though if you took this class, you're gonna have more training within your facility, particularly if you work in a hospital. You're gonna be asked to sign a confidentiality statement, meaning, hey, my name is this one, I'm certified on this, this is my title, and I read all this information, I agree, keeping confidentiality, privacy, and security, all the information that I'm gonna be allowed to see, to handle. They're gonna ask you to sign this document. Remember, when you sign a contract, they have a bunch of papers. Read them, because there are a lot of stuff that is there. You are so happy that you get a job that you just don't want to read it, right? And you just sign things. Sometimes, you're going to be signing for things that then you're probably not going to be agreed. Now, it's too late. Because if you sign, that means, because sometimes they ask you, do you have any questions? No, not at all. When do I start? And then things start happening, and then, but one of the things that you have to sign is this confidentiality statement. Believe me, you will, because you're going to be handling the patient's information. Breach of confidentiality, the unauthorized release of patient's information to a third party. Remember, third party means anyone. But information needs to be disclosed to the patient. The patient needs to know what information is going to be released to this person and for which reason. And we're not disclosing information just because we're going to disclose. It's because we need to refer our patients to that particular specialty for that particular procedure. So again, we cannot leave any information from our patients unattended. That will be a violation of the patient's privacy. Now, it includes that. Now, again, this includes releasing information to the family members. Remember, that's violation of privacy. So can you tell me what is it that my wife has? What was she was diagnosed with? Oh, I'm the husband. Sure, not a problem. You should know. No, that's none of his or her business. Depends on who the spouse is. To no one. The only time that we get that information is when it is a child. Now, a child, but it's not something sensitive. So if it is a mature child or minor, there are certain things that you should not reveal. So to be sure, just don't reveal anything to no one, regardless of what they tell you, period. Talk to the doctor, talk to your supervisor. I have someone right here is requesting for this information. What should I do? What I've been telling you now. So that's basically what it is. Remember, as simple as saying things loud that other people can hear in the waiting area, you are violating the patient's confidentiality, privacy. So you should not. So, Mrs. Brown, so you're here because you have diabetes, right? Yes. Well, they innocently, they are innocent about this. You are violating the patient's privacy and confidentiality. You're telling everyone this patient is diabetic. You shouldn't. You have to keep your voice down, and you have to be as private as possible when you collect information from your patients. So that is basically what it is. Now, I already told you this. If you access information from the patient and you are not authorized to review that information because it has nothing to do with the job on that particular day with that particular patient, you violating the patient's privacy and confidentiality. Oh, you're curious to know. Oh, I saw your, this happens. Oh, that's my neighbor. I'm gonna see. Well, I didn't register this patient or anything like that. Not dealing, somebody else is dealing, but I have access to the medical record. I'm gonna see what you was seeing here for today. You violating privacy. And the administrator is gonna know that you went over there and check that information. And they're gonna find out whether you weren't, entitled to see it or not. If the problem arises because you say something to someone else, that something was overheard by the patient complains in the office, now they're gonna do some investigation. Remember, it's only when something happens that these investigations start. So believe me, all this is very serious. Might not think about that, but it is. HIPAA privacy rule, remember, again, we have to keep all the information the way that I told you already. And this is, this is a law. You can violate this because it has consequences. This is the one that creates all these national, standards to protect the patient's information. Protected health information, PHI. Now, the patients have access to the information. We talk about this. The patient can ask for a copy of the medical records, but they have to ask and they have to fill out a, form that is release of information. Just because it's the patient does not imply that they can just get the information. Oh, I need a copy and I need it now. It doesn't work that way. You're going to request it, you're going to sign the paper, and you're going to say that this information is for you. Then the medical doctor is going to read it, is going to evaluate it, and then 7 to 10 days, we're going to give you a copy, only the information that the medical believes or it is convenient for you to know. Anything else, you won't be able to see it. So that's basically what it is. Always we have to get the consent from our patient. Remember, the consent from our patient, we receive it the first day when the patient registered. We talk about this. You registered, you read the last part. There's a small print. That's what it says. It reads, I accepting, I'm agree with the following policies. My information can be disclosed without my prior authorization to all the associates for my treatment, for my care. That's it. So you cannot sue us for releasing your information to these people that is going to be involved in your treatment. Now, also, it reads, you are responsible for the payment of the services if the insurance does not cover or the insurance do not pay the entire amount for all the balances, you're going to be responsible. So we went over all this, so that will be part of it. So that is what is the HIPAA privacy rule. And you're going to be able to, disclose it to the patient because you have to read it to them. It is a good thing that you explain it to them because the patients just do like we do. Okay, so you sign all this personal information and family history, blah, blah, blah. Now, can you sign down here in the bottom of C where it says patient signature? Can you sign right there? They don't even read what they're signing for. But we have to go a little bit more and be professional and let the patient know what they're signing. Read it for them. Sometimes they don't read English. They are not good with the language. They have language barriers. Sometimes the level of, understanding of education is not good. So they're not going to understand certain terms. So you tell them, oh, what do you mean, HIPAA? What do you mean disclosing? What do you mean privacy, confidential? I don't know, none of those. But you can explain them in a very simple terms. So that's basically what it is. Again, see, here is when we have other term that I mentioned before. Covered entities. Covered entities is the associates. So for billing and coding, for the purpose of releasing information to the people who is involved with the treatment or the payments of the patient, these are called covered entities. And that's why we ask them to sign this registration form and we explain them that we're going to release the information for certain purposes. Now, if you need a surgical procedure, you're going to sign a consent. That's a different issue. That's something else because we're going to inform you the benefits, the risk of your condition. That's a different issue. So any information that is sent over the telephone, communications with the patient over the telephone has to be very, very brief, very, we don't have to reveal much information over the phone. So we can discuss sensitive issues with the patient or medical issues over the phone. Just tell them that we need to see them in the hospital or in the clinic, that make an appointment, and then they will discuss this with the doctor. We already talked about sending faxes. Remember, when we send a fax, the information in this fax has to be confidential. There is a watermark on the cover page that it tells confidential, and only the person who is intended to receive this should be receiving this information. Anyone else should not be reading or, disclosing this information. Or through the internet, when you send emails or text message, you have to be very careful of what information you leave on voicemails. Remember, if you have to communicate something, we don't communicate everything. The most important thing is to tell the patient, hi, this is such and such from this doctor's office. The doctor wants to see you, and when will be, when would you be available to come to the clinic? So please call us at your earliest convenience. And this is our phone number. This is our office hours. That is it. You don't reveal more information. And start discussing, well, you have something, they're not sure what you have in your labs because someone else can read or see the message. You violating confidentiality right there. So again, this is very sensitive. So you have to make sure that you actually follow through all this. HIPAA private rule. Now, again, anything that you talk to with using any media, whether it's telephone, whether it's fax machine, the internet, emails, text message, any of those. you must be sure, that the information that you release is very brief, it's very minimal information, and most of the time we're just giving information about, coming to the office and, making an appointment that the doctor is going to be talking to them, period. Because anything else, it will be really compromising the patient's privacy and confidentiality. So that's basically what it is. Any questions? Well, we're done for today, and we have a long weekend. So enjoy your weekend, but don't forget to complete the exam. You have until Sunday to complete it. There is only like 35 questions. You're gonna have plenty of time. Just spend a little time every day, and you're done. Okay? Enjoy your weekend. I think that you're gonna be staying indoors because it's gonna be cold outside. So again, thank you for joining the class. I will be seeing you Tuesday, and I will be sending you probably a couple of more chapters that we need to cover. So that's basically what it is. Okay. So we are done for today.
Walkways.
Thank you. Have a good night.
Thank you.
Likewise, enjoy your weekend.
Thank you.
Thank you.
Yes, you
Stay
too.
warm. Don't just go
Will do.
outside and get sick because I want to see you on Monday again.
Thank you.
Thank you.
Take care. You're welcome. Good night. Nice weekend. Enjoy it. Bye now.